I think there are a couple of things. One is that um, we as scientists need to stay connected to community. It's tempting to get caught up in the sort of the intellectual abstractions of what we do in the academy and the ivory tower, and potentially get detached from the why, and so fascinated with what, and at least as a clinician scientist, part of the reason why I love science is, again, to solve a problem that I saw in a patient in a way that can help me address the needs of that patient. So it's an extension of my compassion for the patient, that I'm pursuing my passion in science. And so that connection I think is important. The second would be one of, I'll say, a humility, a cultural humility, in which, again, my grandmother taught. It's not that she wasn't a very intelligent woman. She just happened to have been limited to a fifth grade education. And so she had a lot of wisdom and smarts. And so it wasn't a matter of talking down to her to explain something. It was something where I respected where she is or was, and met her at that space, and in which we could learn together. And so I think that's also an important aspect of scientists being trustworthy, and having a posture where it's of mutual respect, in which we have a role, I think, to contribute to that community's health. But we also listen to those communities, because there's wisdom there as well that can help solve these problems, particularly those involving health inequities, where it's not just about molecules that we have to put together, where we have to understand how there's an interconnection between those social systems and the biological systems that we can read about in books and simulate in mouse models, and really put those two things together. Then you start to appreciate that it takes that whole community to heal and to address those inequities. And scientists have an important role, but just one role.